let's start with what is a clinical trial? Clinical trials are research studies that look at whether medical treatments, things like medications, procedures, and surgeries, are safe and helpful in treating different diseases such as cancer. These are voluntary studies, meaning people choose to be in them. Clinical trials can help tailor treatments for individual groups, and they can save lives. Native people are a very small percentage of the US population, about 3%. But Native participation in clinical trials is even smaller. It's tiny, actually, about 0.1%. And as a result, most clinical trials are done on white patients, so we don't have good information on how treatments could be tailored specifically to Native people. So why are Natives so underrepresented in clinical trials? Firstly, Native people don't want to be guinea pigs for science. There's a long history in the United States of researchers using Native people as test subjects without their permission. This caused physical and emotional trauma and has led to a mistrust of research that has been passed down through generations. Fortunately, there has been significant reform in research in the last several decades to protect the rights of participants in research. There is a focus on what we call informed consent. This means that researchers must explain the entire study in detail, including risks and benefits of participating, answering all questions, and patients can choose to participate or not. Also, they can leave the study at any time. Secondly, there's this concern in Indian country about exploitation, or what we call helicopter research. This is the worry that when researchers work in Native communities, they're going to fly in, collect their data, leave, publish their results, and not give any feedback or have any positive change in the communities they studied. This is a valid concern based on past experiences, and it's an area that does need more reform. Finally, Native people just don't know about clinical trials or have access to them at the same rates as others. Researchers and doctors should do better about promoting clinical trials among Native communities, as maybe many would participate if they just knew about them. Ultimately, the more Native participation in research, the more power studies will have, and the more positive change and tailored treatments we will be able to recommend for Native people.